Hello, everyone, and welcome to another episode of Plastic Surgery Unfiltered, a podcast at the intersection of healthcare, business, and the beauty industry. I'm your host, Dr. Armando Davila, joined by my faithful co-host, Dr. David Turer. How are you doing today?
Great. How are you?
Another great day. Today's topic, the gold standard in motion. What 3,000 plastic surgeons are talking about right now.
That's right.
Very exciting. So, Dave, today we're going to talk about this thing that the aesthetic plastic surgeons of America and around the world gather to do every single year. And they gather, right, to compare notes on what's changing in the field. It's not what's trending on social media, not what device companies are promising, not what influencers are trying to sell, but something that is rooted in science and outcomes and really to debate all these things. And so that happened at the Aesthetic Meet 2026 for everyone, and that's in Boston, and it brought about 3,000 people in the field and industry leaders. So just so everyone knows, Dr. Turer, who is my colleague here at the Pittsburgh Center for Plastic Surgery, wasn't just an attendee. He actually helped lead several of the meeting's most important sessions. And so let's get into it.
Yeah, let's do it.
So for people who aren't in plastic surgery, what exactly is the Aesthetic Meet? Like, what is that to you? And
yeah, I mean, the Aesthetic Meet is the the annual meeting for the Aesthetic Society and the Aesthetic Foundation, which is the biggest organization of aesthetic plastic surgeons in the world. Okay. So I'd say this is arguably the biggest meeting for aesthetics. It used to be just aesthetic plastic surgeons, but now with the addition of Allied Pro, probably the biggest aesthetic meeting in the world every year. Okay.
And so how does it differ from, some other conferences or some other, conferences in our society? Who is it sort of sponsored by, I guess, is the big, who's the academic or the institution that kind of runs the meet?
Yeah, I mean, like the Aesthetic Society is who oversees the meeting as a whole. Okay. And obviously one of the major missions of the Aesthetic Society is education, and that's really at the heart of this meeting. Okay. There's no question about it.
And I think you brought a cute little thing, right? Because their mission about education is really about, I think their motto is something about, can you explain the gold standard or the?
Yeah. So the Aesthetic Society has a new motto. It's the gold standard in aesthetics. And I'm personally involved with the Aesthetic Foundation. I'm on the executive board, so I'm the secretary of the Aesthetic Foundation. And so everybody understands that's ASERF, which is the research side of the Aesthetic Society. And so, really what we're seeking to do is to really be the authority when it comes to aesthetics, whether that's surgical or non-surgical, but essentially to be a collection of surgeons and providers that provide the best education in the world and also provide, from the foundation side, cutting-edge research to advance the field.
And so from, in comparison to, for example, well, show them what they gave you. It's a cute little thing.
So Tracy Pfeiffer, who is the president, she actually gave this to all of us. But this was an Idaho Goldback. I had never seen one of these before. It's pretty cool. It says it contains 1/10,000th of a troy ounce of gold. So it says it's $1, but she said it's more like $10.
$10 worth at this point.
But yeah, I mean, it's a kind of a cool token of appreciation. But again, the especially the members of the board of both the society and the foundation, and then obviously a huge number of the members that participate in the education and participate in the committees and things like that. It's a lot of work to not only put this meeting on, but also to create the content and do the education that happens throughout the rest of the year.
So how does this differ from the American Society for Plastic Surgeons and their annual meeting? Like
it's a great question. I mean, obviously it's like the Venn diagram, right? So some surgeons are in ASPS, some are in the Aesthetic Society, and others are in both. And so ASPS is comprehensive for all plastic surgeons. So anyone that's a board-certified plastic surgeon can join ASPS. The Aesthetic Society, you have to be a board-certified plastic surgeon to join, But in addition to that, you also have to demonstrate that you do a significant volume of aesthetic surgery to be a member, at least as a surgeon member. Now, obviously, in the last year, actually 2 years, we've added the Allied Pro category. So Allied Pro is basically anybody else. It can be injectors, it can be providers, it could be a PA, it could be nurse, it could be a practice manager, whoever who wants to be part of the society and have access to that education.
Yeah, I think that's an excellent, I think that that's something that a lot of people in the public, especially those individuals who encounter plastic surgery first from the aesthetic perspective, right, that there is a broad scope. And so at the American Society of Plastic Surgeons meeting, you have craniofacial or, pediatric plastic surgery and reconstructive surgery. You have microsurgery elements. So that's doing operations on tiny little vessels, often smaller than a millimeter in size, often for reconstruction, but sometimes for aesthetics. You have hand surgery, which makes up a huge part of plastic surgery, and then general breast and kind of other reconstructive efforts. And it gets even more specific from there, brachial plexus, nerve-based things, robotics, blah, blah, blah. And so it gets quite expansive. And I think people don't realize how large the plastic surgery as a specialty is. I think the public most in common encounters plastic surgery through aesthetic plastic surgery, and then this meeting kind of focuses on that.
I think you're right. I mean, I think the public in general, when they hear plastic surgery, they think of aesthetic or cosmetic plastic surgery, but the reality is the majority of plastic surgeons and the majority of plastic surgery is actually reconstructive.
Correct. Yeah, exactly. So I don't know do you know how much total viewership?
I actually don't know that exact ratio, but I would say that the ASPS meeting is several times bigger than the aesthetic meeting.
Carly, do you think you could pull that up for us while we keep going here? I'd love to know how many members, how many people come to the American Society of Plastic Surgeons meeting every year compared. So
to the
you can get a thing. So, one of the major, I think in Global Hot Topics, there was a few interesting things. Was Preservé on there?
Preservé was a big one. Yeah.
Okay.
I mean, there's, and that's been a hot topic for the last couple of years. There's surgeons that are really strong advocates for things like dual plane operations, submuscular operations. There's some that are advocates for, prepectoral operations, subfascial augmentations. And then there's some that are starting to use this Preservé technique. And so, there was some really good, robust discussion around that. I think the conclusion is that for a lot of us, at least the conclusion that I took from it is that Preservé is a tool. It's not a catch-all. Mm-hmm. And so in a very specific patient population, it may be a reasonable operation, but patient selection is really key.
Yeah, definitely something like a tool. I mean, we've talked about that on this episode, but that it's a tool more than a true thing you sort of purchase or buy, and it really encompasses a global technique that is all of preservation, and then it's a tool to do that preservation. Right. I have another thing that came up during the meeting, but I want to talk a little bit more about Hot Topics. What was something else that caught your eye on Hot Topics you think is big right now? I mean,
there's Hot Topics this year was great. There was multiple sessions that were really interesting, but the two that I thought were probably the most interesting were both the regenerative medicine side and then the recovery side. There was a ton of presentations when it came to things that plastic surgeons are doing to improve their patients' recovery and improve their experience. Things like topical carboxy therapy, like CO2 lift. There was a great presentation on hyperbaric oxygen and how it's really improved patients' recovery. Different kinds of wound closure devices, things like that. I mean, so there's all this new technology that's coming online. Both to improve surgical outcomes, and then on the regenerative side, I mean, we are just barely scratching the surface on this stuff.
Yeah, I mean, I think that and I love that this is really a focus on Hot Topics, because I think in many previous years, right, it's this sort of obsession with the technique, and really plastic surgeons starting to realize that some of these minuscule variances in technique aren't really what is changing truly outcomes. But if you want to really increase accessibility of these things to patients, you got to make it so that they can actually get the plastic surgery in the first place. And so this is not just about cost. Yes, cost can be a barrier for a lot of people, but for some others, it's just they can't take the time off work. They can't, they can't look the way they do and have the downtime they have. And so as you explore these other avenues, we control pain better. We've done episodes on Dynamics. If you control control, redness or swelling better through lymphatic therapy, through hyperbaric oxygen, through all these things. You can get people to life faster, and even if they have to have some activity restrictions, but they can feel and look
their social
normal,
downtime
and their
is
social
normal,
downtime is lower.
Is minimized, yeah.
You can really make it more accessible.
Yep.
One of the sections I really was interested about was, endoscopic face and neck lift techniques. And, I asked you, there was no hot topic on deep plane. That feels like somewhat settled.
So actually, there was a conversation about that.
Okay.
There was some. I mean, I think that conversation has sort of played out, and people feel kind of strongly one way or the other. But I don't think you're going to change most surgeons' minds about if there is a one best technique at this point.
Yeah, I mean, certainly the evolution, right, is moving. I remember a couple years ago there was certainly this pre-periosteal facelift that has completely fallen by the wayside. But what I took from a lot of the endoscopic techniques is that it's not about it has become, I think, pretty determined, pretty decided that the most long-lasting, the most effective facelifts and neck lifts are going to be those that are ligamentous releasing repositioning procedures, and that without true ligamentous release, you're not going to get longevity and you're not going to get natural results.
Well, some would argue that that's not true.
Some still are fervently against it, but even these endoscopic surgeons who are going for the minimally invasive, a lot of their approach has said, we are doing this ligamentous release just through as smaller incisions if we can, right? And so I'm curious to see, I'm going to explore that a little bit more.
Yep.
Obviously they're always going to present the ones that were endoscopic, but
Right.
all of them say, well, sometimes I need to convert.
Right.
Sometimes I need to remove skin. So the problem with endoscopic techniques is you can't ultimately
Sure.
remove skin, but it really shows to the fact that it's crazy the results they can get, and they remove no skin, which
Right.
really proves their point that good ligamentous release and repositioning produces probably about 70% of the result in a face and neck lift, and that skin removal makes a minor component of
Sure.
the ultimate result. So that's what I really took away from that. How about in your live laser masterclass? What technologies were most kind of discussed, and what was the kind of focus there?
Yeah, I mean, I chaired a couple of courses at the meeting. That one in particular was actually directed towards an Allied Pro audience.
Okay.
And so we focused exclusively on fractionated lasers. So we were, there were 3 companies that were there that showcased their technology. And it's really interesting how far they've come. I mean, all 3 of the devices function completely differently and do kind of different things.
Oh, okay.
Cartessa was there. They were showcasing one of their CO2 lasers. Avava was there. They were showcasing their device, which is pretty unique in the way that it functions. And Cyton was there showcasing Tribrid. So they're all, in the simplest form of the word, they're all fractionated laser devices, but they all work completely differently. It's very interesting.
I mean, that's really interesting to me. I mean, a lot of these laser technologies aren't new by any means, but they're somehow modulating the wavelengths themselves to do new things. Is that what you're saying?
I mean, like the I may not be saying it correctly. The Aveva or Avava device, it doesn't actually it's not like a traditional ablative laser.
Okay.
It actually kind of creates a confluence of energy deep in the skin so that you get what would sort of be like a non-ablative effect from a CO2 laser deep in the skin. And you can adjust that depth almost like, when we're doing, like when they do radiation therapy,
Okay.
how all the different beams converge on one point to get a higher fluence and basically affect whatever that tissue is.
So
that's how this device works.
So the beam entry point is non-ablative, so you don't get
Right.
ablative tissue damage all the way down,
Right.
but then it kind of confluences in almost an subablative pulse.
Yeah, I think it's still subablative, that it doesn't vaporize the tissue, but it's enough that, that it kills it and eventually it's expelled. So,
So that's kind of interesting. It probably is, the claim is less downtime,
Yeah,
but
exactly.
Deeper
Exactly.
collagen remodeling.
Exactly.
I mean, it reminds me a little bit about microneedling, where you have this subablative needle, and then the needle makes a poke, but
right.
kind of curious.
Yeah, I mean it's it's a cool technology. Cyton, like I said, was showing Tribrid, which is a combination of 3 different wavelengths at once. Cartessa's device is a little more traditional CO2, but all of those devices have come a long way from the devices even of 10 or 15 years ago.
I mean, I still remember. I sometimes wonder. I have to message Dr. Gupta and Supi Gupta and see if like they're still using that old like.
What was it? It was
the Ultra Pulse. I mean, it's an old
yeah.
CO2 laser. I mean, and we would still do it, and it gave great results, But certainly, like 4 weeks downtime plus,
Yeah, we've come a long way.
Okay, and then what about the regen medicine? What was being presented that was evidence based, or is there still a lot to go there? What's most is that theoretical stuff?
There were a variety of presentations that were given there about exosomes, secretomes, PDGF. Peter Rubin actually presented his technology on fat banking, which is very interesting.
Okay, he's been working on that for a while.
Yeah, it sounds like they're getting much closer to actually making it usable, where you could do liposuction, use some of the fat, let's say at the time for fat grafting, and then store the rest for subsequent sessions of fat grafting.
Okay.
It's pretty interesting. I mean, there was it was in a different section, but there was actually a talk about this new breast scaffold that is on trial in Australia. So it's made from the same material that we make one of the absorbable sutures out of. And you basically place this construct in the breast, and then you add fat, so you fat graft it. And over time, the construct itself goes away, and it's basically just replaced by fat.
And who was debuting that?
Dr. Diva from Australia.
Oh, okay.
Yeah, I mean, this is fascinating stuff. I mean, some of these things are coming and are, I think, going to be huge changes in the way that we practice plastic surgery.
Yeah, if they pan out and are deployable,
Yeah.
Obviously, I think that sometimes these things can run away with development costs and R&D costs, and then they can be, again, inaccessible to a lot of people. So. You mentioned PDGF, and we talked about it briefly about how that's been one of the biggest kind of failures of the non-surgical realm recently, right?
So it was interesting. I heard this term, and I think this term has been started to throw around of contraindicated. And so basically, there's no indication. It is not contraindicated in the traditional sense, but basically, that there is no indication for this.
Like we should never use this.
It's not off label.
Yeah.
Right. But there is no indication because it's not on. There's no on label for this particular device.
Correct. And I think that like we've also moved into as a society to start saying like you basically shouldn't use this.
Now what's interesting. So Dan Gould apparently did his PhD studying PDGF and said that the form that is being sold commercially is very fragile, and so he's not even sure that there's much viable product available in the product when it's being delivered, which is fascinating.
I mean, it's a skincare product, and so the idea that it is meant to be used as a deeper product is problematic. And
and then the question came up, well, why does it do something? It's hard to know what else is in there. There's it brings up more questions than it does answers.
Sure. I mean, my sunscreen does something. It doesn't have to have like PDGF or protein in it,
Right.
But I do think the way it was being used was obviously a manipulation by the company that created it, and that was a slippery slope, and I think they got shut down pretty fast.
And of course, there was someone there presenting the counterpoint that they love it and they're doing a trial with it. So it's
okay.
And that was actually one of
now
the
they're doing a trial with the commercially available product being sold, or they're doing it with a third, like an isolate of the PDGF.
My understanding is with the Area Essence product, but I'm not 100% sure there.
Okay.
So we'll keep our eyes open for that one.
Another huge one was AI. AI was all over the meeting, just like it's all over basically everything these days.
Yep.
What is your takeaway on kind of AI from the meeting?
I saw a bunch of great talks on AI. And AI, I think when we talk about AI, I think when the world talks about AI now, we're talking about mostly the large language models, right? And so I saw a couple of great talks on how plastic surgeons, I mean, everybody is, but plastic surgeons are starting to essentially create AI search optimization, right? There's Google search optimization, and now there's AI search optimization. And there's some ethical questions. If you put on your website, I'm the best plastic surgeon in the world, so that AI finds that and pulls it up and it shows it to somebody, I'm not sure that that's a great thing. But what they were saying was that it's actually in some ways maybe better than Google because it, in a way, credentials you. And so it looks at everything it can find about you as a whole package. Have you published? What are your reviews like? What does your website say? All of these things to provide a recommendation. And so there were a couple of industry people that were presenting on that, and their recommendation was, kind of go back to more traditional things to credential yourself. Publish. speak. Do the things that are more traditional in an academic setting, because AI will pick up on that and will put you in the public eye.
Yeah, I mean, I think that when you then search for something and it gives you those credentials, you as a consumer, you can quickly distill information about someone.
Right.
And I would say that AI is going to make it, I hope it's going to make it easier for patients to find qualified surgeons and really distill down, things like board certification, stuff like that, right? Like now you can very quickly type in a plastic surgeon's name who's calling themselves the best plastic surgeon, and the AI will sniff out very quickly that they are not a plastic surgeon.
Right.
They'll be like, Jeremy Bentham is a dentist from, Idaho or whatever, and he's practicing in Beverly Hills under pseudonym or whatever. And so it will quickly sniff that stuff out. So I'm excited of that application. My takeaway from AI was that it, from a large language model, I think it can be very useful both for efficiency in medicine in general. I think that it'll reduce note-taking times, reduce kind of things that do not let the provider interact with the patient more. So I'm excited for the future in that. I'm a little bit nervous about its ability to sort of diagnose and predict or try to, you already see, like, weren't you saying someone like submitted a grant and you were reviewing the grant or you were reviewing something, and they're just like sending this stuff out and not proofreading at all, and it was total garbage.
Right.
And so, you have to watch for that. And then I think the biggest detractor or negative about AI is definitely how large language models are being used for video and photographic content, and how patients now may not be able to trust as much of the content that's being produced, and now in relation to the surgeries, right?
Yeah, I mean, there were several talks on that as well. I mean, some plastic surgeons out there are using them to present their before and after photos with nice transitions and things like that. And I think that seems fine. Yeah, nice. That's okay. But, I think if you're using it to basically just create results, which is trivial to do, basically, like obviously that's totally unethical.
And there's someone that is guaranteed someone is doing that right now.
That's happening now.
Right now, someone is doing that to change their photos or alter their photos, and that is going to be harder, which is why more than ever I think that these other credentialing methods are going to be useful for patients.
Right. Isn't it? It's like a war between AI and
AI. And AI. So, Carly, did you end up finding that number?
I did, yeah.
Yeah. How much was it?
I messaged you.
Oh, you messaged me. Cool. Oh, that was slick. We've never done that before. Okay, so that's sort of interesting. So it seems like a 2-to-1 or 3-to-1 ratio. So
how many?
I guess that's pretty accurate.
How many were ASPS?
Anywhere between 4,500 to 6,000, and this is 2 to
total
3,
attendees
1,000.
or surgeons?
Total attendees.
Okay, yeah, that's about double-ish. Because there were about
2 to 3 times.
I think there were about 1,600 to 1,700 surgeons at the aesthetic meet, and about 3,000 total participants.
Okay, well that's the thing. Maybe less non-surgeon participants
at ASPS.
I bet you're right. But I mean that tracks, right? When you look at the amount of people who go into private practice or aesthetics out of when they graduate, it's usually about a 1 to 2, like every one out of like 3 plastic surgeons. So
yeah. I mean that seems to be
pretty
right.
accurate. Okay, how about we have two more things I want to ask. How about part of the huge Allied Pro push was definitely a lot of the business of aesthetic practice. And this is, I think, really big for individuals who are in the med spa industry and kind of this other much more business forward plastic surgery. What did you see that was sort of compelling about kind of business trends, or, what can some of these smaller practices do, or what did you see?
Yeah, I mean, I think, we talked about this earlier. There's some of this content gets kind of recycled year to year. It doesn't really change that much, but I think that there's still a lot of basics that come from that. I personally didn't see as much of that because I was in kind of some of the more technical sessions, but
Fine.
I'm curious because I think
I'll answer my own question.
Answer your own question because I think you were in some of those sessions.
No, I mean, I think if I had to take what is the biggest thing that I took home was I was very happy to see that many of the business talks are thinking more about the longitudinal patient journey and really providing patients with A to Z care over like individual one-time
transactional relationships.
Yep. I've always thought about it that way. I've always thought about plastic surgery that way. This isn't a thing that you just kind of like come in and do once. To me, caring for yourself, taking care of yourself, being the best version of yourself, being extraordinary is really, and finding ways to be extraordinary from a personal growth perspective. It is a journey, not a destination. And, whether you're doing personal trainer, you're in a gym, or you're name a thing, right? This isn't sort of like you come in, we solve all your problems, and then you go.
You wouldn't just go to the gym one time and expect to be buff.
Yeah, like you hire a personal trainer. I did it for a week. I'm good forever, right? You'd go multiple times, and so I think that one of the things that has caused the problems in aesthetic medicine in particular is this idea that you kind of go in and it gets solved and you're done, right?
Yeah.
Like we're taking out your gallbladder, and it's just not true.
Right.
This is a thing that starts as soon as you'd like it to and ends whenever you'd like it to as well. And it takes time. And so it's nice to see, and I didn't, I think our second episode ever was the death of the med spa. And I will continue, it's not going to disappear. But what I read from these business meetings is that the death of the med spa is in fact happening.
At least in the transactional way that
in that transactional way, and that med spas that continue basically acting on that way and not acting in the patient's best interest by constantly just pushing transactions will start to fade and die away. I'm very happy for that. And that, med spas and physicians and surgeons that look at the patient in a more holistic way, look at them on this journey and treat them less transactionally and more about really taking care of them and guiding them through that, are going to succeed and provide better results for the patients. So I'm very, very excited about that movement, and I hope it continues and evolves.
I mean, I think that way of thinking is good for the entire industry. I think
and for the patients.
Well, yeah, that's what I mean. Like, I think that people will have better experiences with the aesthetic space when they're treated that way, as opposed to just like how much money can I squeeze out of them and how many syringes of filler can I put in this person today.
Exactly. So very excited about that. Okay, last things. What was the thing that most surprised you at the meeting?
The thing that most surprised me at the meeting. Let me think. What about you? Let me think about that for a minute.
My biggest surprise was probably imaging.
Okay.
I think that, I think about board collection, and I think about how plastic surgeons have been using 2D medium basically since the days of microfiche. And you would take these photos and you would develop the film and you'd put them on little slides and you'd store them in your practice, and you'd have boxes and boxes. And we've been looking at imaging from a 2D medium forever, and it's fine because I do think it's a nice representation of just what people see in the mirror, right? Because the mirror is also 2D. But we experience the world in 3D, and things move in 3D. And I'm really excited for technologies that are leveraging and allowing us to use three-dimensional imaging technologies and analysis to tailor the result and the experience for the patient more, right? And so, and especially when you start to layer these with other types of cameras, different types of imaging capacities, that is going to be something that I think
was there like a particular device or something that you saw that kind of you thought stood out more than the others?
I mean, I thought the Canfield, what is it there?
The
3D, the Vizia 3D was really interesting. And it's not, again, they're not like first to market per se. They've had this device actually for time, but the ease of access and the way they're taking the photos is faster, is more interesting. And they have some competition too. Some other people are coming down the pipeline with stuff. But that was what I was most surprised. Like, I was not expecting caring about imaging all that much.
I was thinking about it, and like I said, I went to quite a few of the technical sessions, and what I would say is I think that at one point there was a thought that there's a right way to do almost everything, and what I'm seeing in a lot of these sessions is a divergence from that, and that there's a lot of different ways to get good results with almost everything, right? Like, I was in a great rhinoplasty session, and every single presenter presented a completely different strategy for rhinoplasty, and they all got excellent results.
Well, how do you think that, I think that the reverse has happened with patients. Patients are more and more searching for like a specific technique.
100 because it's hot on social media, or they see it on TikTok or whatever it is.
But it's so funny that like patients have started getting to specific techniques after decades of plastic surgeons obsessing about the specific technique, and now the plastic surgeons are all over the place, and they're like, well, in everyone's hands it's a little bit different,
and that's what everyone says, right? Like that's for those of you that don't know, right? That is like a very plastic surgery term, right? Like in my hands, this is how I get my best results, and it's true.
It's true.
You know, I mean, like something that you might do in a certain way and get great results. Maybe I don't do as well, but I do it a different way, and we both get great results. It's just not exactly the same technique.
Yeah, and it's just that's the thing I don't know how to make.
I think where you run into trouble with that is like what we were talking about earlier, is when you only know one technique, right? And you try and apply that to every single patient. Like we've talked about this when it comes to almost everything, right? Yeah. Face, body, breast, nose, you name it. Like we've already talked about a lot of these things on the podcast. But if you just try and apply the exact same technique to every single patient, you're not going to get a great result.
Like that's another question that I think patients should have in their back pocket when they ask a surgeon. They're like, they tell them, hey, like this is what I'm going to do, this is what I'm going to offer you. And a patient, I think, should go to the surgeon and be like, if you weren't going to do that technique, what would be another option for me?
Right. And why are you choosing this?
And why?
Yeah.
And if they can't tell you another thing they do or another way to do it, please don't go to them. I mean, like, I don't know. I know that's harsh and maybe that's a controversial opinion, but to me, like,
you know, we had an attending in residency who, you know, when you were on rounds, when there was a problem, he's like, give me 6 ways to fix this.
Exactly.
Everything, 6 ways.
That's really what plastic surgery is about. There should be multiple ways to solve the problem, and there might be the best way in that person's hands, or there might be, you know, like a ranked list.
Right.
But there's certainly not a one size fits all. And if you are if you really want to go, I mean, I guess maybe some people want a one size fits all surgeon and they match themselves to them, but I think that's a problem.
Maybe there's a few people out there that are ultra specialized that only do things in a certain way, and maybe they only attract just the right patient for that technique, and so it works okay for them.
Sure, I saw a great talk of a guy who really it nails these complex eyelids and complex festoons. I'm sure that's what his entire practice is filled with.
Right.
People who can't be solved by any other plastic surgeon.
Right.
And then, yes, if that's his like one way to solve that problem for that very specific
because nobody
problem,
else can really fix it.
Yes, then go for it. That's your guy. But you know, that's not, I think, the majority of people.
Yeah, no, absolutely not.
What do you think was totally overhyped, or you know, will look overhyped in retrospect?
I mean,
I know it's hard. You don't want to bash anything, but I'm going to put you on the spot.
I'm gonna put it back on you. Let me think about that for a second.
Oh gosh,
you have the benefit of asking all the questions.
I don't know. I'm asking the questions just as fast as you. What is overhyped?
You know, and as exciting as some of these regenerative therapies are, I think a lot of these regenerative therapies are also overhyped because there's a lot of them have no or very little clinical data. You know, when you use certain terms like exosomes, that covers a vast swath of possible treatments and technologies. And so I think a lot of these regenerative therapies, there is tremendous potential. It was actually interesting, just as an aside, I ran into a friend of mine from grad school 20 years ago who was at a gene therapy conference in Boston. And he was part of a team that just got approval for a treatment to give hearing back to deaf children by inserting this particular calcium channel in the cells with gene therapy. Okay. Right? Like,
that's cool.
These are incredible, revolutionary things that are happening, and those kind of advancements will, you know, be part of our field as well. But there's also a lot of snake oil.
Yeah, I mean, like, you know, I can't imagine the amount of R&D that went into developing that calcium gene thing.
Yeah, I sat down with him and he's like, yeah, man, it took us like 10 years to figure out this one thing.
Hundreds of millions of dollars, right? And then the gene therapy is going to be wildly expensive to do for these children. And you're like, why is insurance so expensive? I mean, like, it's crazy. Like, the guy making your skin cream is like, or the guy or gal making your skin cream is not spending $100 million on R&D. And so, like, it probably doesn't do anything.
Probably not.
Yeah.
Certainly not to the degree that something like that does. Yeah. You know, and again, as we previously discussed, that's approved by the FDA. It's gone through the trials. It's done all the things. But yeah, I mean, I think that there is, and this has probably always been the case in our field, right? There's a lot of things that are advertised to be the next best thing, and this is the next best device, and this is the next best product, and they probably are either no better than what's already out there or really don't really do a whole lot.
Sure. I think that for me, the answer to the question is back to AI. You know, I think that, and this is I'll be either very right or very wrong about this. I think that yes, AI tools are going to be very useful. I think in some of these platforms, they will help increase efficiency. But there's an explosion of medical record systems. There's an explosion of like CRM systems and management systems, and all of them are like AI.
Right,
Like suddenly you're gonna launch an AI chatbot, and it's gonna increase your revenue and your patient satisfaction by 300%.
Right.
And no, it is not. Yes, it could ease a lot of processes, but the idea. There's a great episode by Simon Sinek and Will Guidara, two of my favorite authors. Will Guidara's Unreasonable Hospitality, Simon Sinek, Start With Why, and The Infinite Game. He talks about how, in the podcast episode, how AI is actually making human connection even more important.
I was just going to say the exact same thing.
Because AI can never replace that warmth, that feeling, the emotion that humans bring, just because it's too unique. And if we really leverage that as providers and people, that's going to make patient experiences better. And that's what's going to help you run a better business and run a better practice, not, your AI efficiency tool. So I think that's the overhyped retrospect.
Yeah, I mean, I couldn't possibly agree more. Like I said, just like all the other things we talked about, these things are tools, but they absolutely do not replace that human connection.
Okay, we'll wrap up here, but two last questions. What is one thing you're going to change in your practice pretty soon?
Well, there was a great upper body contouring session.
You did immediately.
I did immediately. I had an upper body lift yesterday, so it was great.
Yeah. It was a minor change, a minor market change.
There was a minor market change.
Minor market change, but you use it right away.
Yeah. I mean, there's a bunch of little things I think that we're interested in implementing immediately. Things like different kinds of dressings to improve patients' recovery, and we've been using Genavix, and it's turned out that that's really taking off, and that's really been incredible for a lot of surgeons. So, I think most of the time you don't come back from these meetings and you start doing a completely different operation the next day.
No,
there used to be a joke about that. That when are the most complications? It's the Monday after a meeting.
The Monday after a meeting, yeah.
But
if you're completely changing your whole operation, it's a problem. I mean, I am going to explore endoscopic techniques. I think I'm going to meet up with Cal, and they're coming for the IFATs here in Pittsburgh. And so I'll probably end up doing a course and looking at that cadaver stuff, but I can't implement it right away because, again, I don't really know how to do those surgeries.
Yeah, one of these days.
But yeah, I'll be trying to train in those pretty soon. But yeah, we'll wrap up. I mean, I think that as always, the challenge is not to chase every single trend, but to really identify things that are going to work and improve patient outcomes. And I think the meet has a lot of importance in doing that. And so I thank you for being part of that and building it and being here.
Yeah, I'm excited to do it every year. I'll see you next year.
I'll see you next year. Thank you, everyone, for joining us. As always, here, Plastic Surgery Unfiltered at the Pittsburgh Center for Plastic Surgery. I'm Dr. Armando Davila and Dr. David Turer.
Have a great afternoon.
Bye, everyone.